Hey everyone, it's Marianne from the New York City Organization of Public Service Retirees. This message is for Henry Garrido. I just struggled listening to an hour-long audio from Local 2627 in which you spoke for most of that meeting. In which you spewed misinformation, I'm going to say disinformation because you did it intentionally, as well as also telling people that you had to basically sell off those retirees and put them into a Medicare Advantage plan, because at least they should be grateful that they actually have insurance, but we had to sell off those plans in order to fund the stabilization fund, which you misused. You, Henry, have a weighted vote in the MLC, where the DC 37 Executive Director, you, and the United Federation of Teachers, Michael Mulgrew, have the highest weighted vote in the Municipal Labor Committee. So if you and Michael have a cup of coffee and decide that you want to screw a bunch of retirees in order to get the value of their health insurance to fund your agreements or to fund your raises or to fund your stabilization fund, which mostly pays for your active worker health insurance, that's what you did. And see, I know that's what you did because you actually told that to me in a phone call last fall. I said to you, hey, Henry, why is it that you agreed to give $1 billion, $1 billion from the Health Insurance Stabilization Fund to Michael Mulgrew for the teacher's contract in 2014? And what did you say to me? Come on, Henry. Well, in case you forgot, you said that you gave him the $1 billion because he agreed to do tiered hospitals with you. And that's what you really wanted because you told me how much you really, really wanted that. And see, this is another problem. Tiering hospitals doesn't punish the hospital. It punishes the member. Every time you negotiate a copay or narrowing a network because you say that the hospitals are fleecing you and costing you all this money, is that correct? Well, yeah, they're expensive, right? But did you actually really work very hard with the insurance companies to negotiate lower rates with the insurance companies that they're paying the insurance company, the hospital? No. What you did do was you took the easy road. You decided to pass copays, increasing copays, and in some cases, hundreds of dollars of copays onto active workers and retirees as a cost savings to use in your collective bargaining as value. You did that as rate, and you admitted it. But you're not explaining this to your people. But see, because the rest of us have been retired for 20, 30, 40 years, we know exactly what you did and how you did it. So when you're telling people that the stabilization fund needs funding, but you're not telling them, being as disingenuous as you're being, that you allowed the stabilization fund to be misused for purposes other than health insurance purposes, you're not being honest. And you try to justify it by saying, well, we all took $165 a year out of the stabilization fund to subsidize our welfare funds. I don't understand, Henry. Did you really need that money? Because you told us that the money was flush. Your account, the welfare fund at DC 37 was flush with cash. And we said to you, then you should give us back our donut hole coverage that you took away from us in 2017. And do you remember what your response was then? You said to us, no, sorry, we can't do that. Actually, you said that to Neil. You said, no, Neil, we can't do that. We're using that money now to refurbish 125 Barclay Street. Do you remember that? Because we do. You allowed senior citizens, left them in the lurch by refusing now to cover the donut hole in their Medicare Part D plan that used to cover their expenses. And now you left them to shoulder thousands of dollars of prescription debt so that you could use the welfare fund to renovate Barclay Street, a building that's been vacant for over 2 years. So when you want to say that you had no choice but to do this. Oh, and the other thing you said was that there was a Medicare Advantage component in the 14 agreement. Well, it was an option, but see, smarter heads prevailed. You had 8 options, and in the Bloomberg document, you had 14. The problem is you took the weakest path. You chose to harm people that are no longer in the union and are no longer represented by the union and that you didn't think would fight back. And you also thought we'd be asleep at the wheel and not realize that you broke the law. And when you want to say that the city council didn't amend the administrative code, it's because they recognized that you were forcing them to change a code that would affect their own health care, including ours, and that you violated a law and have done everything you possibly could to go around the judge's decision because 2 courts and 6 judges found on behalf of the retirees and affirmed the lower court's decision, the appellate court, that you broke the law. And so what did you try to do? Change the law, intimidate the entire city council to change the code, and then tried to spew lies about our organization that's been upholding the law because 6 judges told us you violated it. And keep twisting the message and lying to your members. And I'm sorry, Henry, I'm going to end here. But in your summary of your contract, number 5 refers to the MLC agreement. I'm going to ask you one more time, which one? And what does it say? Because what you're not telling your people is that you sold off retiree healthcare programs that today currently affects a current retiree, and you've diminished their future, your active employees' future healthcare benefits. We wouldn't be this successful. We wouldn't be raising millions of dollars and have several attorneys and be going right back to court because you keep doing this to us. You as in labor leaders, used to protect retirees. Now you use us as a cash cow, and I'm not your piggy bank. See you in court, Henry.